Today I want to talk to you about active release technique, otherwise known as ART. Very popular now in the sports community and starting to become popular across the board with all manual therapies. So the concept is that we're trying to break down scar tissue. Scar tissue forms in muscles from repetitive strain injury, from acute injury, athletic injury. Anything that sort of reduces the range of motion, causes pain in the myofascial system can often be managed via active release technique. So the idea is that if we shorten a muscle and then take the contact on the area where there is scar tissue and then lengthen the muscle, the idea is that underneath the contact, scar tissue will start to break up, relieving the patient of discomfort and pain and improving their range of motion and mobility. So I'm going to show another muscle that we can treat with active release technique, the calf muscle, so you can see a little bit better from the angle of the camera. So basically I'm going to have the patient point his toe. I'm going to place the contact on the area of scar tissue, and then I'm going to have the patient bring the toe upwards to his head, into dorsiflexion, that's what this is called. And this is going to be breaking down some adhesions in the lateral gastrocnemius muscle. So we would repeat that a few times. And one more. Good. So that's an example of how you would use it on the gastroc. Another area you could do would be the upper trapezius muscle of the shoulder. So I have the patient sit facing the camera. And what the patient's going to do is going to tilt his head to the right. I'll take an area of contact on the upper trap, and then the patient's going to take his head across to the left. Good. So breaking up scar tissue in the upper traps. You can do this through any area of the body, any muscle. Biceps is an easy example to understand. So contact, and then the patient will lengthen, breaking up the scar tissue. I hope that helps you better understand what active release technique, or ART,